My name is Gustavo.
My name is Angela.
We are going to talk about tongue scrapers and manual toothbrushes for our market research assignment. So first, we are going to talk about tongue scrapers. We are going to focus on what is a tongue scraper, what it's used for, how it's used. We are going to talk about prices, where to buy tongue scrapers, and who is the target audience for marketing strategies. These are different branches and different models of tongue scrapers. They are employed on the prevention of halitosis as a physiotherapy aid on oral hygiene, and there are several different levels of halitosis. On severe cases, halitosis can have social impairment associated with the problem. In this case, the patient and the halitosis is recognized by other people around the patient or around the client. By removing the coating of the tongue, there are differentiation. There is a differentiation on the counting of bacteria in the mouth, in the saliva. Halitosis can have different causes, such as acute febrile illness, respiratory tract infection, Helicobacter pylori infection, gastroesophageal reflux, hepatic failure, renal failure, diabetic ketoacidosis, leukemia, and other conditions that can affect breath and be considered halitosis. So these are images for tongue surfaces. There are coating that can be stained sometimes, especially if the client is a smoker or not, or depending on medications that the client may be using, may be associated with diet, such as coffee, tea, and other things that can stain the coating of the tongue. So tongue scraper is used to remove this coating, preventing halitosis. So for our tongue scrapers, most of products were being sold online, and the average price was from $3.19 to $4.19 for gum. And for Aura Brush, which was a different branch being sold on Shoppers Drug Mart, it was $4.72. There was also another branch, Life, being sold for $4.49 on Shoppers Drug Mart. So, for using the tongue scraper, the client needs to place the scraper on the back area of the tongue and move it towards the apex. Lots of overlapping strokes should be used to ensure a proper coverage of the tongue surface. And for patients who have very strong gag reflex, they can use a lateral movement and also using several overlapping strokes.
Now I'll talk about a manual toothbrush and what is it, what it is for, how it is used, prices, where to buy, and who is the target audience. Here's some examples of the manual toothbrush in the market. Another one, Colgate. And manual toothbrushes are the most important physiotherapy aid used in oral hygiene for self-care. It is affordable and it has many variations in size, shape, and softness. The characteristics of an effective toothbrush are size, shape, weight, and texture that meet individuals' users' needs. It is easily held, used, and disinfected. It is inexpensive and durable. It is functional, flexible, comfortable, and effective, and it has appropriate strength and weight. The manual toothbrush is used for brushing teeth and gums to remove plaque and debris. It can also be used for tongue cleansing. There are different techniques that can be recommended that we will discuss later. The prices often go from $1.90 to $8, and the manual toothbrush can be found in drugstores, supermarket, and online. Normally advertised on TV, social media, and recommended by professionals in dental offices. The manual toothbrush is intended to every person, since children, teenagers, until adults and elderly. The most common brands found in the market are Oral-B, Colgate, followed by Crest and Gum. Here are some examples of toothbrush found on Shoppers Drug Mart and with the prices. And here, one toothbrush who is intended for children. It has these lights here, and this allows the correct time to toothbrushing. Here, some brands that we can find: Oral-B, Colgate, Crest, and Gum.
So I'm going to talk about different techniques for manual toothbrushes. The first technique is the most used one. It's called modified bass. Actually, the only difference between the modified bass and the bass technique is the roll stroke in the end of the movement. So in this technique, the bristles are placed inside the circles, and in the end, after movement, it's rolled towards the occlusal surface or incisal edge of the teeth. Next technique is the modified steel one. It's more appropriated for people who have recessions, and in this case the bristles are positioned more gingivally and not inside the circles. The massage made by the bristles stimulates the circulation on the periodontal tissues. The Chartres technique is more indicated for people who have bridges, prostheses, or orthodontic appliances. So the bristles are positioned in the upper part of the bridge or the orthodontic appliance, and the lower part is brushed at the same time as the occlusal or incisal surface. The Fons technique is not the most recommended one, and both arches are brushed at the same time. And for the lingual surfaces, a head-to-toe movement is employed better than the transverse